All right, so thank you, Jerry, for that introduction. Not the Piggly Wiggly. This is going to be the Wobbly hogs. This is not in the right. Is that better? Can you hear me back there? Okay. So what I'll talk about today is some of the basic background of potentially spinal cord disease. That's what I'm going to interpret as a wobbly hog. So we'll go over what CNS signs are. We'll go through some lesion localization. Sometimes that gets missed on farm, and that can have a big impact on our ability to diagnose disease, as well as differential diagnoses in general for spinal cord signs, clinical signs, and then we'll walk through some selected cases. So when we talk about CNS, that's not coagulase, negative staph, that's the central nervous system. Most people think about the brain. This controls the higher order functions and most of our motor activities. But the spinal cord is also part of the central nervous system. This sometimes gets missed. When we talk about CNS signs, that's a pretty vague term, but that's usually what I see on the submission forms. And so maybe when somebody submits something, they're thinking they're talking about an ataxic pig or a pig that's incoordinated. Maybe they're talking about a pig that's isn't aware of its surroundings, so it has inappropriate mentation. But maybe they're talking about a pig that's circling. Maybe it's acting like it's blind, or maybe they're talking about a pig that's down on its side and paddling. So when we talk about CNS signs, it's important that you tell us what you're looking at, because it makes a big difference as far as localizing within the central nervous system where the disease process is happening. So I'm just going to walk through this to make sure that everybody is kind of thinking how to grab the samples that we need for diagnosis. We'll start with the brain. Anything that has altered mentation, loss of consciousness, things of that nature should be thought of as within the brain. There are other things that are not specific. So one thing that you'll hear frequently is ataxia, or that's just incoordination. Things aren't in the right order. That can occur at the brain level, but can also occur downstream in the parts controlled by the brain. When we talk about a streppy pig or a pig that's down and paddling, again, that's brain. And we're not going to spend any time really talking about these brain type diseases. One region of the central nervous system that gets talked about a bit is head tilt and circling. This would reflect the vestibular system. So if it's in the central portion, that would be in the vestibular nuclei in the brainstem. But there's also a peripheral component. If there's a middle ear or inner ear type problem, people might confuse that as a potential brain issue. And so when they're submitting things, they need to know if you have a pig with a head tilt and a pig that's circling, because that's a different set of tissues to submit. Now we'll move on to the meat of the presentation, which will be the spinal cord. And so when I talk about this, UMN is not the University of Minnesota, as much as I like it. That's the upper motor neuron signs. So when we're talking about signs that pigs might be exhibiting, upper motor neuron signs would say that there's a problem with from the brain down to the motor functions in the spinal cord. And so those signs would include paralysis, paresis, loss of sensation. But an upper motor neuron will often, you may see extensor rigidity or increased reflexiveness to the local reflexes when you look at limbs and things of that nature. Versus a lower motor neuron, this is the wiring that actually tells the limb to move, things of that nature. And so if there's a lower motor neuron sign, you're going to have flaccid paralysis, and you'll have oftentimes loss of the local reflex. So when we talk about how to differentiate where the lesion is, so you know which section of spinal cord to grab, it's important to know if it's an upper motor neuron or a lower motor neuron. So I didn't even talk about the cervical part. So if there's a lesion in this region of the spinal cord, before it gets down into this intumescence here that's controlling the forelimbs, anything that occurs in this region or even potentially in the brainstem, you're going to have lesions in upper motor neuron signs in both the forelimbs and the hind limbs. The next region down is that intumescence area. So this is the cervico-thoracic region. So this is the part where all of the nerves are coming out and telling the forelimbs what to do. So if there's a lesion there, what will happen is those forelimbs will have flaccid paralysis, and the hind limbs will have upper motor neuron signs. It's important to realize that these characterizations are kind of based on compressive or interruptive type lesions. Some of the stuff I'm going to talk about aren't necessarily that type of a lesion, so you can have a lower motor neuron sign in the cervico-thoracic region and not have necessarily a lot of problems in the hind limbs because of the nature of the disease. So the thoracolumbar, this would be the region after the forelimbs come out, but before the lumbar intumescence here. This is what would control the pelvic limb. So anything that occurs between this region here, the forelimbs, they'll be able to drag themselves around. They might be dog sitting, but they'll have upper motor neuron signs in their hind limbs, and they're just fine up front. If we get into the region where the pelvic limbs are controlled, that's where we get flaccid paralysis and loss of reflex. You have lower motor neuron signs in that region. And the last part, the sacral region or the cauda equina, is another area where you might potentially have signs. And in this case, both the forelimbs and the hind limbs they'll be just fine, but you'll notice signs in the tail or the perineal region, so you might have tail paralysis or urinary incontinence. So I thought this was probably too busy of a slide, so hopefully I kind of broke it up, kind of give you a refresher on where to grab things. So I'd point out that this is important because if you told me you had CNS signs, or your farm manager told you had CNS signs, they took the brain thinking it must be strep, right? But in reality, there was a problem down in the lumbosacral region. We won't get you an answer, more than likely. So when we talk about the differentials for these spinal cord lesions, there's a few general categories. I would put them into a compressive type lesion or an extradural injury. There's toxicities that would act directly on the spinal cord, or potentially that might have impacts on downstream signaling. Infectious diseases is what we kind of like to hop on as pathologists. Like, we got something we can do feedback, we can do a vaccine, something like that. And then there's some non-spinal diseases that can show up and look like spinal disease. So it's important that when you're out on the farm, or when your farm managers are out there, that they're collecting the samples that can get those diagnoses as well. So we'll walk through some of these real quick. So extradural compression, kind of the classic would be a fracture, a vertebral fracture. If you see this, one thing that I would highly think about is some sort of nutritional bone disease. So you should probably be grabbing a rib in addition to this fracture site here. You should probably look at your ration to make sure that you've got the right vitamin D, calcium, phosphorus. And then at the same time, you should start looking for other causes. So one of the common causes of vertebral fractures would be electrocution. So if a pig is to get a hold of a live wire, is stimulated with that, causes massive contraction. And so those muscles will actually fracture the vertebral bodies. Occasionally you can have trauma, but the spine is fairly well protected. There's a lot of muscle around that, so that's a little bit less likely. So we'd want to look at potential nutritional issues and maybe some live wires. Another extradural compression would be, fairly common cause would be abscess or osteomyelitis. So this image here is showing the vertebral column here. This red area is the vertebral end plate. So there's osteomyelitis, and then there's necrotic material that's pushing up into the spinal canal, and that's compressing this spinal cord, and depending on where it's at, would give you that answer. The only way that I would be able to get to this is if you sent me that piece of bone. I can say maybe there's some spheroids or something in the spinal cord, but I wouldn't be able to get you an answer unless you look for this. So this might be hard to see. If you can localize the region, cut out that section of spinal vertebral column and all, cool it down and send it in, we can section it on the bandsaw and look for that type of a lesion. Ascending infection, so if there's something local that penetrates in, that can cause a problem, but most often this is some sort of prior septic event. Again, this is the vertebral end plate, so there's a lot of tortuous vessels in there that the bacteria can seed. One of the classic toxicities that's specific to the spinal cord or often manifests in the spinal cord is selenium toxicity. I have a case of that we'll talk about. Other toxins can have spinal cord-like signs, but often end up causing problems up in the brain as well. So classically, salt toxicity or water deprivation might start with dog-sitting pigs and then progress to down pigs, paddling pigs, and dead pigs. Similar with some of the heavy metals, most of our commercial pigs are not going to be exposed to these, but if you've got backyard pigs, that'd be something to think about what they're exposed to. And then in our infectious disease, the most common spinal cord specific would be the viral myelitis, poliomyelitis causes. They're pretty diverse. Most of the time we think about the picornaviruses. So this would be similar to human polio. Lately in the U.S., been reports about kids having acute flaccid paralysis. So that's the same thing. It's polio. It's just a different virus that's causing it. There's several pig viruses. Teshovirus would be our kind of classic, and then there's some other emerging ones that we talk about. Sappilovirus, porcine astrovirus, not a picornavirus, but other viruses, HEV, hemagglutinating encephalomyelitis virus can potentially cause these similar signs. And then there's others that we don't see too frequently, like rabies, or we've eradicated pseudorabies from our domestic population. But those would be potential viral causes. And then these three I put on the list. Again, edema disease, it might show up as a dog-sitting pig or CNS signs, or the spinal signs, but ultimately you need to look elsewhere. So if you send me the spinal cord from an edema disease pig, I'm not going to give you an answer. So you need to make sure that you're also collecting intestines so I can look for E. coli and characterize that. Botulism and tetanus, these are in the book, right? So if you eat preformed botulism toxin, they can have issues, or if you have a local infection. And then tetanus, again, if you've got maybe a bad castration, something like that. But I'm not going to give you an answer if you send me in spinal cord. I probably won't even be able to give you an answer if you try to send me the abscess, because it probably won't grow. So some of these are based on your clinical assessment, and others are things that I can do in the lab. Last category of differentiation would be looking at those things that are non-spinal. So make sure that you don't have some sort of an arthritis event, right? So maybe they've got an infectious arthritis. If they've got some osteochondrosis or maybe a physeal disease where you've got some improperly formed cartilage and you get an avulsion fracture, you might get a pig that won't get up because it hurts too much, but not necessarily because they don't have control. So you'd be looking at making sure that they can actually voluntarily move things. Ionophore toxicity, that's what this image right here shows. So the skeletal muscle should look like this, but it's all necrotic, and this causes muscle weakness, but these pigs are awake, aware. They can move their limbs if they need to. Oftentimes they're painful. That differentiates them from some of the other diseases where they're just paralyzed. They don't act like they're painful. These pigs will vocalize if you try to get them up because it hurts. And then last, porcine stress-like syndrome. We've kind of eliminated the ryanodine receptor problem, but occasionally you get these pigs that quiver and go down, and will have similar lesions to porcine stress. So you'd want to make sure that you're getting skeletal muscle as part of your rule-out package if you're talking about spinal cord disease. So our first case here, nursery pigs. These are 3 weeks placed, and there are 200 pigs in the group. 6 of the pigs started exhibiting spinal cord signs, and they were unable to rise. The submitting veterinarian did their necropsy and didn't see any gross lesions. And so we received tissues from 2 pigs. So hopefully this works here. Where's the... So this is submitted by the submitting veterinarian. Watch this pig here. So this pig, it'll loop through here. You can watch as uncoordinated, starts to lose control of the pelvic limbs, and then as it gets down to the other end, the other pigs start pushing on it, right, and it's not able to support itself. It has muscle weakness. And so this would be classic of a lesion that would be potentially in the lumbosacral region or the thoracolumbar region. The forelimbs seem to be fine. So the problem seems to be in that caudal end of the pig. So if you just send me the brain or even the cervical region, I might not get an answer. So it's important to localize where that is. So this doesn't project very well. I guess I'm not getting the distinction here. Just to orient you on the spinal cord, this region up here These are the dorsal gray horns. These are the portion of the spinal cord that receives the sensory information. The ventral gray horns are down here. So this is the motor neurons. This drives your voluntary motor function. And then right here's the central canal. That's the cerebrospinal fluid flowing through there. And then there's modulatory neurons here in this kind of medial region. And so this image is from one of those pigs. There's an increased cellularity. You see these kind of grayish, bluish areas. That's cellular infiltrate. And so in order to figure out what's going on, we need to go to higher magnification. And so what this image shows is infiltration of lymphocytes and macrophages here, these kind of dark circular cells. And then here's a neuron. For frame of reference, this is a fairly normal neuron. This neuron is pink and necrotic, so there's neuronal degeneration and necrosis with lymphocytic infiltration. And so when we look at that, you look at the report, it says lymphohistiocytic poliomyelitis with neuronal necrosis. What does that mean, right? It doesn't mean a whole lot. It's pretty non-specific. And so you need to go for ancillary diagnostics. In this particular case, we got PCR positive for porcine tetrovirus on both of those spinal cords. And this would be kind of our classical spinal cord disease in pigs. This has been described for a number of years. When we look at the pathogenesis of why do we get this, fecal oral exposure is thought to be the most likely route. The virus comes in, most pigs are exposed, they replicate in the tonsil and the intestine. Most of the time it's asymptomatic, they don't have any problems, but there's going to be a subset, or potentially if they've never been exposed to that particular virus before, or the gilt hasn't been exposed, you get a viremia that allows viruses to get into those neurons. There are certain neurons that are predisposed to infection, and those include the motor neurons and that ventral gray horns that I showed you on the image there. Once the virus gets in, you get inflammation and neuronal necrosis, and that's what causes your clinical signs, because it lost the wiring to tell its legs what to do. And so we kind of have the answer for why it does that. So this is the second case. These are finishing pigs. These pigs are 2 weeks placed. And in 4 days, past 4 days, 15 out of the 2,000 pigs have died. 4 more were sick on the day of presentation. And these pigs, they're reported to lose control of their front legs quite frequently. Then they'll go down, have difficulty breathing, and then they die. Necropsy, there's no gross lesions to indicate why that might be happening. So in that video, that pig, it wasn't perfectly normal in the back legs, but it had more control and more function in the rear limbs. The forelimbs were completely paralyzed. It could kind of throw itself up and get posted, but then it would fall back down and couldn't get up again. And so when you look at that from a localization perspective, the issue appears to be right in that region that controls the forelimbs. So the intumescence that lives between the neck and the thorax has the problem. Because this isn't necessarily a compressive lesion, you don't see upper motor neuron signs in the rear limbs. So if this had been a fracture in that region, that pig would not be able to get up. The rear limbs would be completely paralyzed. So because this is a little different disease process, you have to be careful when you're interpreting upper motor neuron versus lower motor neuron. But that flaccid paralysis is pretty specific to lesion localization. So this image again is showing the spinal cord. We have dorsal gray horns, relatively unaffected. We have ventral gray horns where the motor neurons hang out, and then the median area where you have regulatory type interneurons. And again, we have these pockets right here are indicative of inflammation. There's a little bit of cuffing of blood vessels. When we look at higher magnification, again, we have swollen neurons, degenerate neurons, and infiltration of that region by lymphocytes, macrophages, and we have a lot of extraglial cells in there. So we have the same diagnosis. We have lymphohistiocytic poliomyelitis. What does that tell you? Not a whole lot. Highly suggestive of viral infection. And so you're still dependent on your ancillary diagnostics. And in this case, it's porcine sapillovirus that was detected. Negative for Tesho and some of the other suspects. And so here, kind of demonstrating that we can't just look at histo and get you an answer. We're still dependent on those ancillary diagnostics. Pathogenesis in this case is uncertain. This is a picornavirus and closely related to teshoviruses and other enteroviruses, so it probably has a similar type pathogenesis, but it hasn't been described exactly how we get the neural component. But pigs can be infected and not have CNS signs. Third case, this is a sow, down sow, unable to stand. That's the history here. When we look at the spinal cord, are you guys detecting a pattern here? So here we have ventral gray horn, dorsal gray horn. We see some infiltrate there in that ventral gray horn. In this case, there's a little bit more vascular cuffing, but we still see these big swollen neurons. There's a decreased density, so some of the neurons have already been lost. And then we have infiltration of lymphocytes and macrophages with glial activation. So we have the same exact diagnosis. You think this is going to be either of the other two? No. So this is porcine astrovirus type 3. So the key here is viral myelitis looks like viral myelitis looks like viral myelitis. And I can't tell you what it is by looking at this. And don't assume that just because you got teshovirus the last time that it's going to be teshovirus again. You need to make sure that we do additional diagnostics to pin that down because we just can't get to that granular level. Again, the pathogenesis is uncertain. This is a completely different viral family. It's still a positive sense non-enveloped RNA virus, but it's not an enterovirus. It's a little bit different, group. This case is now we're moving on to a different topic. The history is central nervous system signs. So again, I don't have a whole lot to go on there. In this case, there were gross findings, and so along the right side of the neck, in the meninges, inside of the spinal cord, there was this thickened area, and it was pushing the spinal cord to the left. So displacing, I have a mass effect. 5-week-old pig, older pig, I might wonder about maybe it's got some tumor or something there. But in this case, here's the spinal cord, ventral horns, nothing really going on there, but I have this massive expansion of the epidural fat by cellular infiltrate. And so when we look at that, we try to figure out what that is. What I have here are multinucleated giant cells. So this cell here has about 5 nuclei, and it's surrounding a central globule of fat. So this clear area is fat. So what I have here is a granulomatous steatitis. So there's fat necrosis and inflammation that seems to be focused around some sort of a lipid. There's other macrophages and lymphocytes in the background here as well. But there's no bacteria in here. There's no viruses detected on screening. And so what I have is a granulomatous steatitis and meningitis with compression. I don't have any agents identified. So here's the question is, I don't know what caused this. This is kind of one of those zebras. We don't really know. Occasionally you'll see this. I suspect that this is probably due to an inadvertent epidural injection. So this is up in the neck. Pig could have gotten poked with a needle. And then material gets in, maybe causes necrosis of the fat, and that recruits an inflammatory response. So this is described in cattle that receive certain vaccines, and this pig was vaccinated with PRRS virus. There's other things that could potentially be there. So this is something that's completely off the wall. If you had sent me the brain, I couldn't have gotten you an answer as to why this pig had a problem. Last case, 40-pound gilts. These are downer gilts. About 4 days after arrival, they'll go down. No gross lesions. 3 pigs, we had tissues received. And so in this case, we have lesions in the gray horns, but these are very symmetrical. It's hard to determine what's going on at this magnification, so we'll go up to a higher magnification. So what we have here are a lot of neurons that are degenerate. Some of them are necrotic. But these cells look a little bit different than the lymphocytes that we saw before. These are a little bit bigger. There's macrophages and glial cells that are coming in. We also have vascular proliferation right here. And so what we have is a big area that was potentially necrotic prior to. You've got glial cells coming in, and you've got vascular invasion to try to repair that. And this is an example of bilateral symmetrical poliomyelomalacia. We've got neuronal death and loss and neovascularization. And when we look at the ancillary diagnostics, the answer doesn't come from the spinal cord or the brain. It comes from the liver. And so in this case, liver selenium is 11, 11, and 7 on those 3 pigs. upper reference interval goes to 3.2. So this is a subacute selenium toxicosis. So it's important that when you're looking at these types of things, we get an idea of where the disease is, what the histopathology is, and go from there. In this case, there's a lot of uncertainty. We think it probably has to do with reactive oxygen production and damage by that. So take-home messages, make sure you localize your lesions, help your pathologist out, tell us where the lesion is and what the signs are. Viral poliomyelitis looks like everything else. We need to do more work. And then make sure you're submitting non-CNS tissues because the answer might not be in the spinal cord. It might be something completely different. So keep that in mind. So many thanks to our pathologists that shared their cases with me. Thanks to our producers and veterinarians that submit stuff to us. Send us videos. We love videos. And it helps to give us an answer.